Welcome again to Active Living TV. I'm Natasha, and today we are talking about one of our most important subjects here at Active Living. It's health and wellness. And there's one part of our body that we all take very seriously, but sometimes we might just take it a little bit for granted, and that is our sight. So today we're going to focus on the health of our eyes, but also the comfort of our eyes. So everything from the health of our corneas and our retinas all the way down to the treatment of something as simple as dry eye, which, as we all know, can actually be a pretty big nuisance. So to help us out today, I have with us our health and wellness expert, Tony Lawrence, and and our very special guest today, the optometrist to the stars, one of the biggest names in Hollywood, Dr. Myles Zakheim. Thank you so much for joining us today.
Nice to see you guys today. Thanks for having me.
Good to see you.
So I think we have a couple questions for you today. We're really curious to learn a little bit more about eye health, and I know our viewers at home also would love to learn just some basic questions and some basic answers.
Well, I, for one, want to know exactly what is dry eye and how do you treat it?
Yeah.
Well, dry eye right now is the most prevalent problem running throughout the country these days. About 20 million Americans suffer from dry eye, symptoms, various irritations, and discomfort. Specifically, dry eye is a situation where the tear film on the surface of the eye either evaporates more quickly, not able to lubricate in the surface of the eye, or the eye doesn't produce enough fluid, leading to complaints of discomfort considering scratchiness, burning, excessive tearing.
And what is the best way to treat it, the easiest?
Well, it's a myriad of approach that you need to deal with dry eye. It's not just one specific thing, but the first line of defense is lubrication, artificial tears in the form of moisture drops that can be used for some simple cases just twice a day, upwards of 5-6 times a day.
Right. And how do computer screens, iPads, iPhones, how do they contribute to this malady?
Well, the problem with computer screens is that it doesn't make your eye drier, but when we're dealing with any type of monitor, whether it be an iPhone, an iPad, a computer monitor, we're not blinking as much. We're sitting and we're staring at all these electronic devices. So we're not allowing the blink process allows tears to move across the surface of the eye. So when we're staring at things, the tear film dries out and all those symptoms are exacerbated. So there's more burning and there's more stinging. When the eye gets dry enough, and sometimes it can actually be subclinical, that the eye may not irritate you physically, but when the tear film dries out, it actually has a tendency to affect the clarity of the vision. So dry eye not only causes physical discomfort, but it could also cause visual blur as well.
That's interesting. I didn't know that. I have a question about dry eye because I've never known if there's a difference or if there's a link actually between when your eyes itch and when your eyes are dry. I mean, I feel like when I'm in different environments, suddenly I just want to keep rubbing and it makes them more itchy. Is that something similar or is that different?
Well, they're related, but initially when a person complains about my eyes are itching, the first thing that we think about as clinicians when a patient comes into the office is, my eyes are itching, the first thing we think about is allergy. But itchiness, allergy, and dry eye go hand in hand. When the eye has an allergic response, it's itchy, but the eye also gets drier. So the use of a moisture drop not only compensates for the dryness of the eye as it lubricates the eye, but it also acts as water does for your body. It flushes out whatever allergens are in the atmosphere. So if a person is having an environmental allergy, which is causing the itchiness, the moisture drop will clear out the allergen, whether it be pollen, grasses, animal hair, anything, just common dust. So it's a very good cleanser as well as a lubricant as well.
Doctor, tell me exactly about these products and what they are specifically.
TheraTears is one of the artificial tears that we use for the treatment of dry eye. TheraTears is made available in a bottle form that is preserved and in individual ampules that are single-use containers. When a person and they have the same ingredients in it, and the active ingredient in this is called carboxymethylcellulose, which is a lubricating factor for the treatment of dry eye. And if we're dealing with a person who has a mild issue with dryness and we're using drops 2 to 3 times a day, then we're utilizing what is in the bottle. If a person is using drops 5-6 times a day, and this is certainly variable because there's certainly different degrees of dry eye irritation, then I like to go with an individual ampule dose because it's preservative-free. We don't want to have recurrent uses of chemicals and preservatives in the eye along with the treatment itself.
And then this is the lutein.
Correct.
I'm pronouncing this right, okay.
Absolutely. Lutein is for the treatment of macular degeneration. That's a nutritional supplement, and when one does get macular degeneration, then we actually have a diminished amount of lutein in the macular area. Lutein is a protective portion in the macula that protects us from sunlight, and it's sort of like having a pair of sunglasses on in the back of your eye. So when that's diminished, that's one of the issues that are involved with macular degeneration, so lutein brings that back into the system.
So I'm actually curious, what is the macular? I hear you use that term a lot, macular degeneration. I'm not even sure what that is.
The macula is the area of central vision which is located in the retina. So when we're taking a look in the back of somebody's eyes during a routine examination, we're first looking at their optic nerve, then we're looking at the blood flow, and then we end up in the area of central vision, and the area of central vision is the macula itself. When you were describing a little bit earlier about this black spot in a person's vision that doesn't go away, you were describing actually macular degeneration. That's a breakdown of the tissue in the back of the eye. And we find that with macular degeneration, we're missing certain nutritional supplements. Those would be lutein as a primary factor. And so that's what we use this for, is to supplement the nutritional value in the back of the eye.
Got it. It's kind of the wizard behind the curtain, and you need it to be working to be able to see. Is that?
That is true.
Oh, I'm learning so much from you, Doctor. I'm so glad you're here.
Because no matter what's going on in the retina, if the macula is damaged, glasses at any prescription, surgery at any prescription,
Yes.
whether it be for the remediation of glasses or contact lenses, will not be effective if there's damage to the macula.
Yes.
That's why these supplements become so important.
It's like enamel. You have it or you don't have it. You can't regrow it, essentially. I have learned so much from Dr. Zakheim. Thank you. I'm definitely going to be picking up these products. I don't think that there's anyone who doesn't need to have or doesn't want to have healthier eyes or a more comfortable vision. So the first thing that we're going to talk about is the TheraTears Lubricant Eye Drops. It is our bottle right here. We have the bottle of eye drops. It's a great price already at $19.95, and we're selling it right now at activelivingtv.com for a really great deal of just $15.99. And this, of course, has a ridiculous amount of doses. You can just use this bottle forever. And the product number is TH1001. However, if you would like to get the individual packs, we have these as well. They have their advantages. For me, I lose everything. So if I just like to take one thing on the go and I lose it, I still have all the other packages at home. And he also mentioned that these are preservative free. That's amazing. I think this is also a great deal, and they're the same price. On sale from $19.99 to $15.99, with the product number being TH1002. These are the TheraTears preservative free ampules. And lastly, of course, as we mentioned, the lutein. I know I'm going to be taking this. I really want to be proactive against macular degeneration, and I don't really know anyone who wouldn't want to be. It's just a really fantastic supplement for anyone. And this product number is ZK1001. The name is 21st Century Lutein, one of the best names on the market. The price normally is $19.99. Great deal. We're selling it for $14.99, and I will be taking this home with me. You should too. Go to activelivingtv.com right now.